Okay, so today we're going to talk about SI syndrome, or it's called sacroiliac syndrome. And this typically happens with a lot of women after they give childbirth. Where it's actually located, it's really where the dimples, it starts where the dimples of the back are, and it goes all the way progressively down. It's where the spine meets the hip bone. And that attachment, that joint, it's supposed to be stabilized and not move too much, but after giving childbirth, it opens up the hips, allowing for the delivery of the child. So when it does come back into place, sometimes it can be off. It also happens if you sit down a lot, you can get irritation. So there is a movement of that joint, and there is a lot of irritation. There's a ligament that lines both of them, and that can get very irritated very quickly. So when you do get assessed and you do come into the clinic, we do check all the back, and we especially check into the SI joint. So a back pain could be into the spine, but it could be related more so in here. And if that's the case, we do a lot of therapy for it. We would do acupuncture along the ligaments to help with the irritation or inflammation of the ligament. We would actually adjust the joint into place. It can be off at the top or it could be off at the bottom. And then we would teach you exercises to stabilize and make sure that it doesn't move out of place. So that's something that we would do at the clinic for sacroiliac syndrome. And it can be one-sided or both. Most of the time, if one-sided is affected, then the other side will overcompensate and eventually be affected as well. So this kind of therapy, it usually takes 1 to 3 months for proper healing and to really heal the source of it in terms of the muscles, the joints, and stabilizing it. If you have any questions, please feel free to come to the clinic for an assessment where a chiropractor and a physiotherapist will look at this issue. Thank you so much.